Abby, I'm going to take off my screen sharing, and it is all yours from here.
Okay, well, thank you. My name is Connie Baker. I'm with Neurelis. I have a brand new medication called Valtoco. It's a rescue nasal spray indicated for treating seizure clusters in kids as young as 6. And what makes Valtoco very unique is they've taken the molecule diazepam and added Intervil and vitamin E, and gives the product a 97% bioavailability. And that's going to last throughout a 24-hour period. So a good product to have as part of a seizure action plan, especially in a school setting, because we have the indication in children as the age of 6. So the second speaker of the day I'd like to introduce is Abbey Roudebush, who will be discussing the Seizure Safe School Act. Abbey is a senior manager of government relation and advocacy at the Epilepsy Foundation, where she manages various state and federal legislative issues, including the Seizure Safe School Act and access to care issues like medical, cannabis, and CBD. Abbey joined the foundation in January of 2018 after working on state-level legislative issues, including healthcare policy, education, labor, and civil rights in New York. Abbey earned her degree in Bachelor of Arts in Political Science and English Writing from DePauw University and her Juris Doctorate from Albany Law School. She is a member of the Washington, D.C. Bar. So please welcome Abbey Roudebush.
Thank you so much, Connie. Let me just try to share my screen here. Okay, here we go. So thank you so much for having me today. I'm here to talk to everyone about Epilepsy Foundation's initiative, the Seizure Safe Schools Act. This is a state-level bill that our local offices are working on, and many of the states have plans to work on this legislation coming up. And so I'm just going to take the time today to talk through the legislation, why we believe it is needed, what it will do, and then I can give a little more specific update on what's happening in the states and Washington in particular toward the end before we have time for some questions and answers. Okay, so brief overview. Despite the prevalence, epilepsy is still highly misunderstood by the public. We find that unless you know somebody or are close to somebody who has epilepsy and seizures, some people have some pretty dangerous misconceptions, like that you should be putting something in someone's mouth when they're having a seizure. So there's this general misunderstanding, not by any one particular group. And then typically children spend most of their waking hours in the school setting. I should note that things may be a little different right now because of COVID-19, and students may still be doing virtual school or only be in school part-time right now, but it's everyone's hope that eventually everyone is back in school and things are back to normal. And so in those circumstances, children will be back to spending most of their time during the week in the school setting. So it's critical that at least, one person in the school can administer medication, especially seizure rescue medication. And it's critical that all school personnel, everyone in the schools who are really charged during the day with making sure that students are safe and well taken care of, know what epilepsy is, how to recognize when a seizure is happening, and how to safely provide seizure first aid. And so for students living with epilepsy, it's important that these schools are well equipped with all the tools necessary to provide both a safe and an enriching environment for all students, including students living with epilepsy. Which on the right side of the screen, you can see this is particularly important because 1 in 10 people will have a seizure at some point in their lifetime. and 1 in 26 people will develop epilepsy at some point. So, you know, when you are a teacher or a school administrator working in a school with hundreds or thousands even of students, there's a good chance that at some point in your career, if not multiple times, you will encounter a seizure or have students living with epilepsy. Our overarching goals of this legislation is to ensure that all school personnel, which includes school nurses, teachers, volunteers, school bus drivers, anyone who is charged with the care of students during the day, are prepared to recognize and respond appropriately and efficiently to any student experiencing a seizure. We also want to safeguard physician-directed care in the school setting by allowing students to have access to necessary and oftentimes life-saving medications. From time to time, we hear from parents or from school nurses that they are uncomfortable administering seizure rescue medications, or a parent is having trouble getting some assurances that if their child does have a seizure emergency, that something like a suppository will be administered. And so, you know, it's not always the case that access to care in that sense is preserved in the school setting. And we're not accusing anyone of doing anything nefarious. We just want to make sure that if they don't feel prepared to administer this, we want to make sure that they have the training and the tools they need to be able to provide whatever care the student needs. And then also another one of our goals is to bring awareness to the entire educational community, making sure students living with epilepsy or seizure disorders can feel safe in school and reach their full academic potential. And then also we want to help kind of break down the stigma around epilepsy and seizures and break down some of these misconceptions so students can build meaningful friendships. So our model bill, to speak a little more specifically, there are 5 key components, and I should start off by saying that this is what our model bill looks like. So this is what our ideal bill looks like in the states that pass. But because every state is different, and because there are other circumstances or even other laws already in place in states, not all of these components always pass. And so this is something that we may end up going back to in the future to try to get. But just so you know, the model bill is our ultimate goal, which would first require school personnel to complete a seizure recognition and first aid training program. The Epilepsy Foundation does offer these free programs, which I'll talk about in just a second. Then also mandate that a seizure action plan is made part of the student's file. We want to make sure that anyone who is responsible for the student during the day has access to a seizure action plan, so they know specifics about the child's epilepsy or seizure disorder, exactly what they should do in the event of a seizure, and it also has emergency contact information. So we want to make sure that everyone has access to that. We also want to ensure that any FDA-approved medication prescribed by the treating physician is administered to the student living with epilepsy. So, you know, as long as it is FDA-approved and their physician says that a student needs it, we don't think that it should be denied during the school day. We also aim to educate and train students about epilepsy and first aid response. And then there's also a Good Samaritan clause in there because we want to make sure that school personnel, teachers, nurses, anyone acting in good faith who has taken a seizure first aid and recognition training, that they are protected under the law as long as they act in good faith. And that helps, that also helps the bill pass when they know that there are some protections in place for them. And it's pretty standard in other legislation like this, like for instance, for administration of EpiPens under diabetes law, or insulin under diabetes law. To talk a little bit more about the seizure first aid training that we do offer, that does go along with this legislation. Ideally, a state will use our training because it was developed in partnership with the Centers for Disease Control, but our ultimate goal is just to make sure that they get appropriate training. So the training that we offer for school nurses specifically is approximately 2 hours and 45 minutes long. It's available on demand or live right now. Because of the pandemic, we're doing virtual training sessions that have been widely attended and very successful. And in these trainings, we aim to make sure they learn how to identify 2 of the most common seizure types, as well as potential triggers and risk factors, 3 ways in which the treatment of epilepsy may affect a student's health, safety, or learning. So not only are we looking to educate them about seizure first aid, but kind of taking a holistic view of how epilepsy or seizures may impact not just their health, but their safety and their learning. We want to teach them how to apply 2 strategies to help alleviate any psychological challenges related to epilepsy. List 3 first aid steps. So this is making sure that they know stay safe side. And then we want to make sure that school nurses know how to properly create a seizure action plan, because we want the school nurse to be very involved in the development of it. And then because these were done in consultation with the Centers for Disease Control, we have also been certified for continuing education credits. So school nurses will be able to get credit for taking our course, and they do get a certificate of completion at the end of it. And then we also have school personnel training, which is about an hour and a half long, which goes into a lot of the same things. We want them to be able to recognize 3 common seizure types. We want them to know stay safe side, seizure first aid. They should also know 3 key factors that would make a seizure a medical emergency, and be able to describe 3 ways that they can help support students living with epilepsy. Again, there are continuing education credits for this, and they do get a certificate of completion at the end, which is also important for reporting to the state. All of the Epilepsy Foundation trainings are free, and we also include other free resources like seizure action plans, seizure first aid posters, observation tools, and parent questionnaires. All of those can be found on epilepsy.com. To go into a little more detail about the seizure action plan, this provides child-specific information about their seizures, triggers, medications, and other medical information. So first, we look to give them a general overview of epilepsy and seizure first aid through our training, but then the seizure action plan is where they can really hone in on a student's specific needs and specific triggers or medications, any circumstances that teachers should be aware of that are specific to the student that may not have been covered in a general training about epilepsy. This is filled out in consultation with the child's physician and in collaboration with school personnel. The school nurse is very involved to make sure that the student gets the care that they need during school. This also equips school personnel with the information, again, that they need to provide that is specific to the child and their care during the day. And also this helps ensure that they know the right protocol to follow and that they can follow it. So school personnel are really on the front line of helping to prevent emergency situations because a seizure can happen at any time, in any place, in front of anyone. There are often some critical moments where a teacher needs to step in, where a school nurse or someone else, it may take them a few moments to get to the school, if there is a school nurse in the school. So we really want to make sure that these school personnel, the teachers in particular, who are really with the child the majority of the day, are able to provide at least that frontline initial care to ensure that these students are safe. I'm going to talk a second about the importance of the FDA-approved medication language. This is specifically for the problems that we encounter with rescue therapies, although it does apply to some anti-seizure medications as well. In general, we all know that timely access to appropriate physician-directed care, including prescribed FDA-approved anti-seizure medications, while on school grounds, it's critical for students living with epilepsy or seizure disorders. If you yourself have epilepsy or a seizure disorder, or someone that you care for or love does, you know how important it is to take your medication on a schedule and to really be diligent about that schedule. And so we want to make sure that students are able to continue their care plan while they're at school. Also, children with epilepsy may experience life-threatening seizures at any moment and need access to their emergency seizure medication when they're at school. It's not as simple as saying that I'm not comfortable administering this medication at school because we don't know if a child will experience an emergency. And it's not like a student or child or anyone living with epilepsy or seizures has control over that. Some children are susceptible to prolonged cluster or status seizures, which may last longer than 5 minutes and can lead to serious injury, even death. For these children, in particular, a physician may prescribe an emergency or rescue seizure medication. So again, when they enter prolonged cluster or status seizures, it's important to be able to administer care and to know that your child or a student is getting the care they need in a timely fashion to avoid any serious injury or even a death that maybe could have been prevented. That is the last thing that we want. So we want to make sure that school personnel and nurses are equipped with the training so they can administer this medication. Non-medical school personnel should be trained to administer this medication so children with epilepsy can have access to the full range of school and related experiences. Sometimes we hear from parents, some of you may have experienced this before, but if a class of children is going on a field trip and there may not be a school nurse who accompanies them. Often if schools have a dedicated school nurse, there's only one and they can't leave school grounds to go on every field trip. And so sometimes we hear that teachers say that they can't take the rescue medication along with them because there's no nurse to hold on to it or to administer it, and they don't have the training to. So we're looking to make sure that people have the training they need so students living with epilepsy don't miss out on any school experiences. And it's also crucial that caretakers administer these in a timely fashion, which I mentioned earlier. So, you know, again, if they are off campus on a field trip, or if a school nurse is maybe across school grounds or not present that day, that shouldn't be an excuse for a student not receiving their rescue medication. Let's see, I'm trying to change the slide, but it looks like it's, there we go. So to talk a little more specifically about what we have been doing in the states with this bill, so far to date, 5 states have passed this legislation, and it has gone into effect in all 5 states. Those are Kentucky, which was the first to pass this kind of legislation in 2018. And then in 2019, Indiana, Illinois, and Texas passed their version of the Seizure Safe Schools Act. And then at the end of 2019, but it was signed into law in January 2020, New Jersey has been the latest state to enact Paul's Law, which is the name for their Seizure Safe Schools legislation. In the 2020 legislative session, state legislative sessions, which started in January in most states, we had 18 states that introduced Seizure Safe Schools legislation, including Washington. And I just want to take a moment to talk about this session and why it was different in particular we had a lot of movement and a lot of interest in most, if not all, of our bills in the 2020 legislative session. And it was looking promising, and we were doing a lot of educating lawmakers and the public, not just about the need for this legislation, but we were educating them about seizure first aid as well as we were doing that. And so in a lot of states, we had committee hearings, and we even had floor votes in a lot of states. And then, as everyone knows, at the beginning of March, the country kind of came to a screeching halt, including state legislatures, because of the COVID-19 pandemic. And so because the state legislatures were rightfully focusing on the pandemic, none of our bills passed in the state legislative sessions this year. So that is absolutely not because of the merits of the bill, and it doesn't have any bearing on whether this legislation will pass in the future or not. But COVID-19 kind of derailed or just delayed the efforts, and we absolutely think it's important for the legislatures to have dealt with that. So we will be introducing many of these bills again in the 2021 legislative session, which starts in just a couple months. I almost can't believe it. But again, I'm not sure yet because of the election. Some states haven't even finished counting ballots yet for state level officials. So we're waiting to see some states how their legislature might change. And we are also waiting to see what a lot of legislatures are going to focus on in the coming years. Each state sort of has their own, well, each state has very different needs that they need to address for their citizens. And so we will be looking at each state very carefully in the coming weeks. We've looked at a lot already to see where a bill might be viable and where one might not, but still kind of the lingering effects of COVID-19, the legislative session may look a little different this year, which is important to note for anyone who may be watching this who isn't located in Washington State. Just important to keep in mind that when I go into what is happening specifically with the Washington bill, that there may be different circumstances in your state, but that we are still looking to push this bill in every state that we can in 2021. And if 2021 is not a good year, then it'll be an education year for states where we educate them about epilepsy and seizures, and then we will introduce a bill in 2022. So our goal is to get this passed in all 50 states, but each state might be on a different timeline. Specifically about Washington quickly, and I'll let Kevin jump in at any time if he has anything else to share. There was a bill introduced in January 2020. There was a House committee hearing on it. I am actually located in Washington, D.C., but the Washington State thankfully broadcasts online their hearing, so I was able to watch all of the wonderful testimony given on the bill. And then again, because of legislative deadlines specific to Washington State, the bill was not able to advance. So again, COVID-19 pandemic is just important to note that, especially because in some states, I'm not sure about Washington in particular, but because a lot of states are still doing virtual schooling, either 100% or part-time, even the educational needs have changed, and we're not exactly sure what they'll focus on. So we're looking at a pathway through that. But Washington does have plans for introduction in January 2021. So right now is a lot of education on the topic, why this bill is necessary, on seizure first aid, stakeholder meetings. There are other groups like school nurse groups, teachers unions, school administrators who have opinions about the bill. And so we want to listen and engage other stakeholders so we can make sure to reach an agreement to have the best chance of success as possible. And then the bill still has to go through drafting. So they have to draft the official language for it. And once that is done, it should be ready for hopeful introduction. So that's what we're planning now. But just keep in mind, things do change all the time in every state with every legislature. So this is a very fluid process that we just kind of have to be patient for. And a lot of times the legislative process is sort of hurry up and wait. There'll be a lot of work, and then you do a lot of downtime, a lot of waiting, and then all of a sudden there's a hearing on it. So this is kind of an up and down process that you just have to be patient with. And then lastly, before we get to any questions that you might have, I have a few resources, and I will keep this screen up while we, if anybody has any questions while we go through that, so you can have all the information, either take a screenshot or write down. So first, you can visit advocacy.epilepsy.com to learn more about the Seizure Safe Schools Act. But on that website, you can also learn more about the other advocacy that the Epilepsy Foundation does. The Seizure Safe School Act is not the only thing that we work on. We work on a lot of access to care issues, preserving your access to medication. We work on medical cannabis and CBD issues, health insurance coverage, the Affordable Care Act, Medicaid, Medicare. So please feel free to visit that website and take a look around. You can also sign up to become an epilepsy advocate at this link, and there is also a link on advocacy.epilepsy.com. And by signing up for that, you will get our monthly newsletter that will keep you up to date about all the issues that we're working on. And then you also, when you sign up, we need you to enter your address and zip code, and this is so we can identify your state and federal legislative districts. So if there is ever an opportunity to reach out to your local or federal officials, we make sure that you know about that, and we make it really easy to contact your federal and local officials about issues that mean a lot to people living with epilepsy. And by signing up to that, you'll also get action alerts about the Washington Seizure Safe Act, so you could send letters to your local officials about that as well. So please make sure to sign up for that and get on the mailing list, and we'll make sure that you're notified when there are opportunities for you to lend your voice. If you have a story to share about an access to care issue, or about the importance of seizure first aid in schools, if there has been an instance that has happened with yourself when you were in school, or a child, or if you're a teacher and you have an opinion about this, please contact us at publicpolicy.efa or at efa.org. And we'll reach out to talk to you. These stories are very important for putting a face to the issues that we work on to elected officials, to let them know that these are real issues that impact real people. If you're interested in getting involved in the Washington bill, if you live in Washington State and are interested in getting involved in the Washington bill, please reach out to Kevin and he can give you the information to get involved. And if you do not live in Washington State, but you would like to get involved with the Seizure Safe Schools Act in your state, or get an update with what is going on in your state, if you are connected to your local office, I recommend that you reach out to them, but you can also reach out to publicpolicy@efa.org, and we are happy to connect you to your closest office that covers your area and give you an update on Seizure Safe Schools Act. And with that, we can open it up if anybody has any questions, or I'm not sure if Kevin wants to jump in with anything more specific about the Washington bill that I may have left out.
Abby, this is Chris. We do have a couple of questions here.
Great.
Just very quickly for you. This is one topic you touched on a bit in your topics there, but I want to ask directly, as someone had posed this question. Say a school has a nurse that can only administer or be the individual to administer a child's rescue medicine, and school nurses, for example, can't always be on campus. How would you go about this with the school?
Right. So that is a good question. It's one that really was honestly part of the inspiration for this legislation in the first place, because that is a common problem that we run into. So unfortunately right now, because the way some state laws are set up, the nurse really has to be the one to administer medication. But in our bill and an agreement that we have come to with teachers and nurses and some of the other states where this bill has passed, is if there is not a full-time school nurse in a school, which quite frankly covers most, if not all schools in a state, if there's not a full-time school nurse there, then at least one other person who is there full-time must be trained on how to administer seizure rescue medications and seizure maintenance medications. So that's something that we're currently aiming to try to fix with this legislation, so we can make sure that this problem doesn't keep a student from accessing care. And I should also say that, you know, our ideal situation is having at least one school nurse in every school full time. And I know that that is the all school nurse, that's their goal as well. They want one school nurse in every school. But because of many challenges in states, including budgetary challenges, that's not a reality right now. And so this isn't necessarily meant to be a permanent fix where a non-school nurse does end up administering medication, but because there is no answer right now, this is sort of our Band-Aid fix until we can make sure that every school has a school nurse.
Excellent. Well, thank you for that. That's everything for the questions and answers side. So all to Kevin from here, and thanks again, Abby.
Thank you.
All right, thank you, everyone. If you joined us late, I'm Kevin Kopis. I'm the executive director here in Washington, and thank you, first of all, to Abby. She has been a huge, excuse me, resource for us. When the bill was first, being discussed and introduced, we had a draft bill created by a policy writer, and I sent it to Abby. She made some changes and suggestions to it, sent it back to the policy writer, and they made all those changes. So Abby's been great to work with. As she mentioned, locally here, and I've kind of been the point of contact working with the bill sponsor, who is Shelley Kloba. She's in 1st District. Shelley has a big background on PTAs and actually has a healthcare background. So she was like the ideal person to get to sponsor this. So she immediately jumped on board. We've since had, a variety of other sponsors jump on. One of them that I believe is soon going to be jumping on, we've discovered has a daughter with epilepsy. So he's, a huge proponent of as well. Other things, as Abby mentioned, we're on schedule to have it filed on time. Actually, the legislative assistant to Shelley Kloba told me he's going to have it filed next month. So it will enter the 2021 session. Of course, we don't know what the budget is like, so chances might be a little slim, but because we had such a positive first hearing with the Education Committee, we're pretty hopeful that it's going to gain some good momentum. If you're interested in tracking it, once we have a bill number, excuse me, we will broadcast it to everyone. So if you're on our mailing, you're not on our mailing list, join our mailing list, because I imagine most of you are, because that's probably how you heard about this conference. But join our mailing list, and once we have a bill number, we'll send it out, and then you can go in and track it. Actually, the Washington, legislature has their own website where you can track bills, and you'll see where it's at, what committee it's in, what the next steps are. So it's a great way to keep updated. Finally, if you're interested in getting involved, as Abby mentioned, send me an email. We're looking to, and my email address is right there on the screen, we're looking to create sort of a committee of representatives from various legislative districts kind of throughout the state of Washington, who can then go and meet with their local representative. Of course, it'll probably be virtually these days. But as you know, representatives are hired to represent or elected to represent you. So requesting a meeting, they kind of can't say no to it. So they will schedule a meeting with you, and at that time, you can talk about the bill. And we have some kind of talking points around it that you can use when you're talking about the bill. So would love to help. Email us. Thank you again, Abby. And Chris, if you have any other questions, feel free to ask them.
We do have one last question, and Abby, this may be one for you, but are there specific trainings for teachers? Obviously, you've touched around a number of those topics in seizure response and proper response in general, but do you have anything or would recommend an area to go, maybe on the internet with videos or et cetera, specifically for trainings for teachers that can be helpful if useful in any way?
Yeah, and that is a great question, and I am glad that it was asked, because I should have mentioned this when I was talking about the trainings, but all of our trainings, the school nurse one and the school personnel one that I talked about in this presentation, those are currently available on epilepsy.com. I don't know the exact link off the top of my head, but you should be able to find it if you search for it on epilepsy.com. But both of those trainings are up and running and available for anyone to use at any time. So teachers and nurses can take our training and they can get the continuing education and the certification before this bill has even passed. This legislation isn't necessary for them to take the training. So if you would like your child's teacher or school nurse, or if you were a teacher or school nurse yourself and you would like to take this training, you can do that right now online at epilepsy.com.
Excellent. Thank you for that, Abby. That concludes everything for the questions. And I just wish to say thank you for everyone that submitted them and all the engagement in general. So thanks again, everyone.
All right, thank you all for joining us today, and thank you to our speakers and sponsors. We hope you will join us tomorrow. We'll be back at 11 a.m. Pacific time to hear Dr. Jackie French talk about advances in therapies for epilepsy. And you will use the same link that you used today. So we hope to see you tomorrow morning. Thanks. Enjoy the rest of your day.